A leading British doctor has taken up residence in Dunedin as the Elaine Gurr Chair of General Practice at the University of Otago. Professor Tim Stokes comes from the University of Birmingham, where he was the Senior Clinical Lecturer in Primary Care. He joins us to talk about the move to Dunedin and his new job. Good evening, Professor Stokes.
Good evening.
Now tell us about the role that you've just started here in Dunedin.
Absolutely. I'm the new Elaine Gurr, Professor of General Practice here in Dunedin. I guess you might be wondering who Elaine Gurr was. She was a female GP and obstetrician whose career spanned pretty much the whole of the 20th century. And she endowed Dunedin, the medical school here at the University of Otago, with the first professorship of general practice in New Zealand back in 1983. And I'm really pleased to be the third holder of that post. My role, it's a senior post within the medical school, is to provide leadership in general practice, both in teaching and in research, here in Dunedin, across the country, and indeed to contribute internationally to developments.
How is this job different to what you have been doing?
I've been involved as an academic general practitioner. What that means in plain English is that I basically see patients part-time and also work in the university sector for nearly 20 years. I've been building over those years an interest in both teaching and research. This job's a natural progression for me. It's a senior appointment, and I'm really delighted to be able to come here and to use hopefully my leadership skills to actually grow and develop the department here in Dunedin.
And you've been involved in some major research in the UK. Can you tell us about that?
Of course I can. And one of my main interests is something called knowledge translation. That means essentially getting evidence, for example, results from drug trials or devices, into routine clinical practice, in particular in primary care. There's many ways you can do that, because actually changing clinical behaviour is quite complicated, and we often have to not only educate doctors better, we often have to put in new systems for them to work, and also sometimes get the health system to change. And I did that in the UK through working with a body called the National Institute for Care Excellence, which is better known as NICE, which I worked for over 10 years, and I used to develop something called clinical guidelines, which, just to explain, means, for example, telling practitioners how best they could, for example, manage someone with epilepsy, for example, or diabetes. Through that, making sure they improve the care for their patients.
And you also research doctor-patient relationships.
That's right. That's an interest of mine. I'm a GP, and one of the great things about being a GP is that we look after people as people and not as a knee or a liver or a heart. And in that relationship, continuing care, that is seeing the same doctor, is really important. So one of my interests is looking at how we can do that and how we can best make sure that relationship works best for both doctor and patient, what we call a therapeutic relationship.
Will you be working as a GP while you're here in Dunedin?
I will indeed. I've got no news on that at the moment because I'm currently in discussion, but I'm very confident that in the next couple of months you'll see me in Dunedin as a part-time GP somewhere.
What do you hope to achieve at Otago University?
I really hope to basically grow general practice here. The department here does great things in medical education. We run a number of programs, including something called the SECO Clinic, Safe and Effective Clinical Outcomes Clinic, that I know is well recognised internationally and has actually just been taken up by a leading UK medical school. So we do some great stuff here, and it's really important to produce doctors who can both treat patients properly, but can also listen to them, understand them and care them. That's a really important aim of mine. And the second aim, from what I said earlier, is to do research that has an impact, that we really improve the care for our local communities as well as the care more widely in New Zealand and overseas.
How long do you plan to live here in Dunedin?
Well, I've only been here a month and it's all new, but I'm loving it, I really am. And if the job works out, if my kids are happy in school, and I tell you they love their schools here, so, and my wife, most importantly of all, Jo, settles, then I think it's going to be a very difficult decision to go back to the UK.
Professor Tim Stokes, thank you so much for your time.
Pleasure.
After the break on 39 Dunedin.